name is Ryan Reinhardt. I'm a student nurse practitioner. Today is Wednesday, March 25th, 2026, and I'm going to be recording my abdominal body exams video. Before we get started, I'm going to do a room tour of the room. We are in a bedroom. There's my workspace of a ruler and a Sharpie for the liver mark. This is the walls. And then the floor over here and the ceiling. And this is the door. All right. Now I'm gonna set my laptop on the thing and we're gonna get started. So I'm gonna perform hand hygiene. In the real world, I would use warm soap and water. Before we get started, I would like to obtain verbal consent. So I'm gonna record this video for my instructor to view and grade, post it on YouTube as unlisted. Do I have your consent?
Yes, you do.
All right, verbal consent is obtained. So I'm gonna start with inspection. I'm gonna inspect your eyeballs. Your sclera appears to be white. There's no indications of jaundice. If there was, her sclera would appear to be yellow. Now we're gonna move on to inspection of the abdomen. So I'm going to place my tools right there. I'm gonna place a pillow under her legs for her abdominal muscles to be relaxed. And I'll have you pull up your shirt just below your bra line. Just going to move the camera a little bit so you can see. All right, so I'm gonna start with inspection of the abdomen. I'm gonna look from the top and both sides and from the side. So her abdomen, the contour of her abdomen appears to be soft, flat, non-rounded. It is pretty symmetrical in size and shape, and there's no peristalsis noted. I also do not see any redness, bruising, striae, any masses or hernias or dilated veins, or redness. And I also do not see any signs of recent abdominal trauma or injury to her abdomen. So now we're done with this inspection. I'm going to move on to auscultation. Using the diaphragm of my stethoscope, I'm going to auscultate in all four quadrants of her abdomen. Let's see. Starting in the right upper quadrant, I'm going to listen to her bowel sounds using my diaphragm. And the right lower quadrant. And the left lower quadrant. And the left upper quadrant. Okay. Bowel sounds are present, normal, active, and I hear about 1 every 2 seconds. 1 to 2 every second, which it would be an estimated frequency of about 30 to 34 bowel sounds a minute, which is a normal finding. Now I'm going to auscultate her abdominal aorta, her renal arteries, her iliac arteries, and her femoral arteries. I'm going to first use my bell of my stethoscope, and then I'm going to switch over to the diaphragm. So starting with the bell, the midline above the umbilicus, I'm going to listen to your abdominal aorta. Now using my diaphragm. Okay, I do not hear any bruise or friction rubs at her abdominal aorta. Now I'm going to listen to her right renal artery using my bell. And the left renal artery. Now I'm going to switch over to my diaphragm to listen to the right renal artery. And the left renal artery. Now I do not hear any bruise. Now using the bell of my stethoscope, I'm going to listen to her iliac arteries. The right iliac artery. And the left iliac artery. Now using my diaphragm, again with the right iliac artery and the left iliac artery. I do not hear any bruise, so I'm also going to auscultate her femoral arteries, starting with my bell Can I just have you pull your pants down just a little bit? Okay. Now with the diaphragm. And the left femoral artery. And with my diaphragm again. Okay, after auscultating the abdominal aorta, the renal arteries, iliac arteries, and femoral arteries, I do not hear any bruits or friction rubs noted in all of those arteries. This is a normal finding. Okay, and now on with percussion. I'm going to percuss your abdomen, starting in the right upper quadrant. My dominant hand is my right hand, so I'm going to percuss with my right middle finger over my left middle finger. And then in the right lower quadrant, and then the left lower quadrant, and then the left upper quadrant. Okay, I hear tympani as I percuss all 4 quadrants of her abdomen. Now I'm going to percuss her bladder. Alright, I hear tympani over her bladder. This indicates her bladder is either empty or lightly filled, which is a normal finding. Now I'm going to percuss at the right midclavicular line down to her right lower quadrant, and I'm going to percuss upwards to her liver edge until I hear dullness. Right, dullness is present over the liver. I'm going to grab my Sharpie. I'm going to make a little mark where I hear that. Okay, and now I'm going to percuss starting at her midclavicular line, right above the umbilicus, and I'm going to percuss upwards until I hear that dullness again. Alright, I'm going to make a mark there. Okay, now I'm going to use my ruler. Let me put this down. In centimeters, and I'm going to measure in centimeters her liver span from the marks that I made. Her liver span is about 7 centimeters. A normal liver span is 6 to 12 centimeters, so this is a normal finding. I'm going to put my ruler away. And now I'm going to percuss over her spleen, starting at the left anterior axillary line, and I'm going to percuss laterally downwards. Okay, I hear tympani throughout percussion over the spleen down the left anterior axillary line. Spleen enlargement is unlikely. Now I'm going to test for the Castell sign. So I'm going to start in the same area, the left anterior axillary line, and percuss, and I'm going to have the patient take a deep breath in and out. Alright, can I have you take a deep breath in and out? Okay, negative Castell sign, which indicates there's tympani heard while the patient is taking a deep breath while I percuss over that area. A positive Castell sign would indicate or would show tympani switching to dullness when the patient takes a deep breath as I am percussing. So now I'm going to move on to palpation. I'm going to start with light palpation using my dominant hand, one hand, and some circular motions. I'm going to start in the right upper quadrant. Okay. In the right lower quadrant. And then the left lower quadrant, and the left upper quadrant. Alright, any pain or tenderness?
No.
Alright, I do not feel any abdominal tenderness or muscular resistance upon light palpation, which is normal, so now I'm going to switch to deep palpation with my dominant hand over my non-dominant hand and go in circular motions. In the right upper quadrant, the right lower quadrant, left lower quadrant, and in the left upper quadrant. Okay, I do not feel any masses or hernias, and then did that cause you any tenderness or pain?
No.
Okay, now I'm going to palpate the liver edge. Taking my non-dominant hand, I'm going to place it under her ribs. And then I'm gonna take my dominant hand and kind of palpate for the liver. I'm gonna have you take a deep breath in. Okay, and out. And one more time. And out. Okay, so the liver edge is palpable. It is soft and was that tender or painful?
No.
Non-tender, non-painful, and no nodules were felt as I was palpating her liver edge. Now I'm going to palpate her spleen. The spleen can be difficult to palpate due to it being directly under the rib cage. But I'm going to place my non-dominant hand under your rib cage and kind of palpate right here. I'll have you take a deep breath in and out. Okay, one more time. And out. Alright, so the spleen is not palpable, which is normal in most cases. I'll have you turn onto your right side for a second. I'm going to palpate your spleen. Have you straighten your legs. Okay. And I'll have you take a deep breath in and out. And one more time. And out. Okay, you can lay on your back. The spleen is not palpable, which is not abnormal due to it being under due to it being under the rib cage. So now I'm going to move on to some specialty tests. Starting with the fluid wave test. This is a test that indicates or is suspicious for ascites. So I'm going to have you place your hand right in the center of, or right in the center of your belly button, and give it a good press. Okay, I'm going to put both my hands on her side, and I'm going to start on the left side. I'm going to tap, and on the right side I'm going to tap. Alright, this is a negative, you can put your hand down. This is a negative fluid wave test. I did not see any transmission-like or wave-like movements across her abdomen when I was tapping and as she was pressing down. A positive fluid wave test would show some wave-like movements or transmission from side to side while I would tap. So there's no indication of ascites. Now moving on to the Murphy sign. This Murphy sign test is for suspicion of cholecystitis. So I'm going to deeply palpate her right upper quadrant and have her take a deep breath in. Okay, right upper quadrant. Can you take a deep breath in and out? Okay, was that painful or tenderness in any way?
No.
Alright, so this is a negative Murphy sign. If the patient had severe pain or tenderness or was unable to finish her inhalation, that would indicate a positive Murphy sign, which would show some cholecystitis. Now on to McBurney sign. McBurney sign, this is a test used for appendicitis. So starting in her right lower quadrant of her abdomen, I'm going to palpate over her right lower quadrant. Any tenderness or pain?
No.
Alright, and there's no rebound tenderness. If there was, this is a negative McBurney's sign. If there was signs of appendicitis, there would be some rebound tenderness and pain with the deep palpation in the right lower quadrant. Now I'm going to test for CVA tenderness. This test is for pyelonephritis. So I'm going to kind of do this to the back of both costovertebral angles. So I'm going to have you sit up, sit on the side of the bed, move the pillow out of the way, and I'm just going to start on the right costovertebral angle and just any pain or tenderness?
No.
Right, and same on the left side. Alright, any pain or tenderness?
No.
Okay, you can sit back now. So there's no pain or tenderness on bilateral costovertebral angles, which indicates no signs of polynephritis. If there was signs of pyelonephritis upon the palpation on the costovertebral angles, the patient would be in pretty severe pain or a lot of tenderness upon the palpation. So that concludes my abdominal body exams video. Thank you.